Good day everyone. I am Michael Jason Villa from BSN M98. So today I will be demonstrating on how to provide the patient bed bath, shampooing, oral care, and back massage. So first, I will review the patient's chart for any limitation on physical activity. Next is that I will gather all the equipments on the bedside of the patient to conserve time and energy. Next is that I'll perform hand hygiene and put on my gloves to prevent cross-contamination. Next is that I will identify the patient and explain the procedure to reduce anxiety. So, good morning, sir. I am Michael Sanjay from student of. So, before we proceed, can you please state your name, your age? So, may I please check your ID bank or verification? So, sir, I will be providing you a bed bath, shampooing and oral care, and also a massage. Would that be okay? Yes. Okay, thank you. So, next is that I will offer the patient bedpan or urinal to because warm water can stimulate voiding and uh, to prevent interruption during the bed bath. Okay, so next is that I will place the towel under the patient head and over the chest. Next, I will rinse my washcloth and I will use it to wash the patient's face. So I will start on the eyes from inner to outer. Next, from the forehead to cheek. On the other side. Also next, the ears naman on the other side. Next, the neck. So I will pat dry the face. So next, I will wash the arm. So I will expose it. Then I will put towel under the arm. Then I will rinse the washcloth. Then I will wash the hand to the axilla. So we'll do the same procedure on the other hand. So since I can go to the other side of the bed, um, assume that I already done it. So next, I will pat dry the hand. Then cover it again. Then we'll move on the patient's leg. So I will expose it, and then I will put a towel under the leg. So we rinse again the washcloth. Then we will wash it, the patient's leg from the feet to the upper. So we will pat dry it again. Then we will cover it to provide privacy. So we'll do the same procedure on the other leg. So since I can go to the other side of the leg, assume that I've already done it. And also, since the patient uh, requested me not to remove his clothes, so I will respect that decision. So, but in clinical setting, we should remove the patient's clothes to clean the upper chest and the abdomen. So next is that I will provide shampooing. So uh, assume that assume that I have shampoo tray. I will put it under the patient. I will wet the patient's hair. Then I will put shampoo on the patient's hair. And then I will massage it to remove dandruff and to clean the scalp. If the patients have a thick hair, we should put conditioner to smoothen the hair. Then I will wash it again. So next we will apply it. Okay, so next I will remove my gloves and perform hand hygiene. Then I will change my gloves since the other one is dirty. Next is that we will provide the oral care to the patient. So we will assist the patient into sitting position. Then we will remove the towel. Then we will provide a basin and a cup of water to gargle and split it on the basin. So sir, then So next is I will brush the patient's teeth from here to the back to remove the flakes. And we will also scrape the patient's tongue to prevent halitosis or bad breath. Tapos po natin, okay. So we will ask again the patient to gargle it. So the purpose of oral care is to remove plaques, prevent gum disease and cavities, and that next I will position the I will return the um, patient into comfortable position. Then next is that I will remove my gloves and perform anti. Then this is to prevent cross contamination. Then we will perform back massage. So I will ask the patient to I will place the patient to lateral position. So we can do it or we can do it on prone or lateral position. But my patient um, asked me to do lateral position. Then we will expose the back, only the back, to glove massage. So um, it's up to you if you put gloves or not. But since I'm comfortable with massaging with no gloves, so I will not put it. Then I will put moisturizer or lotion. So this back massage promote good circulation and relaxation to the patient. Okay. So next I will lower the shirt again and I will turn the patient into comfortable position. I will arrange the liner. And then next I will perform hand hygiene.